Young lady, what is your name?
My name is Judy.
Hi, Judy. Which city are you from?
I'm from Windsor.
What kind of problems were you having that brought you into our office?
I was starting to have extreme left knee pain. Had originally a right knee replacement surgically, and didn't want to have that again. And long-term suffering from low back pain.
Okay. How many years were you suffering with all this?
Low back pain, 20 years.
20 years.
20 years.
And what about the knee?
The knee, about a year.
About a year or so. Okay. So how was this affecting you throughout your daily life?
I was miserable. I was miserable. Would put doing things off, starting to limp again.
Really?
Considering a cane. Yes.
Okay. Okay. And let's see, now this is something you were dealing with on a daily basis and pretty much?
Laterally the knee.
Mostly the knee?
Back is off and on for 20 years.
Off and on for 20 years?
Mm-hmm.
When the back would get really bad, what was it like?
Excruciating. Tension, pulling, couldn't move.
So what would you do when that would flare up like that?
Take pain medication.
Okay.
Or just lie down flat, which probably is the worst thing I could have done, but that's what I did.
Kind of
I didn't know what to do.
Kind of ride out the storm, so to speak, huh?
Yeah.
Okay. So it's been now roughly 5 months, I believe, since you've had the care.
November,
Can you tell me, what kind of response have you had?
Well, my knee is very, very good now. It probably took a couple of months, but now I really don't have any pain now. It doesn't hurt when I bend, doesn't hurt when I go up the stairs. I feel great now with my knee. Back is probably about 50-60% better.
Awesome. Very good. So you're still getting flare-ups with your back periodically, but is it the same intensity, or what would you say?
No, it's not as bad, and they don't last as long.
Wonderful.
The flare-ups.
Excellent. Thank you very much. I appreciate that.
You're welcome. Thank you.